Papillion Fire and Rescue trains for all kinds of emergencies, from responding to an active fire call, ice water rescue during the winter, and of course, working on the latest life-saving techniques and training available. But there is one call that, although rare, requires some extra teamwork.
Most of our calls are obviously adult patients and not pediatric patients. That's a very small percentage of our calls, and of those small pediatric calls, there's even fewer that are actually life-threatening.
Carol Gupton is Papillion EMS manager. When the call is that small percentage, local departments around the state reach out to the Children's Hospital Critical Care Transport Team, a protocol that started after a life-threatening call back in 2016.
Actually a call that kind of instituted us having this idea that we should tier with the Children's Transport Team because we were taking very sick kids and taking them to Midlands Hospital. That's our closest hospital within our territory. And Children's Transport Team was basically going to Midlands to get the kid to take him to Children. Instead of them chasing us to the hospital, we're like, we can get better care, get it quicker if we go towards them and we can meet up.
Papillion Fire joined with Children's for the initial pilot program.
I think it's such an excellent resource for the region.
Becky Meredith is the Transport Outreach Coordinator at Children's Hospital and Medical Center.
It's kind of a brainchild with Papillion Fire Department and the current transport leadership of our program in around 2016. And since then, it's grown to the majority of the metro areas surrounding counties. So today, we do more than 3,000 rescue calls a year, all infants and children, via our ambulances, helicopter, and airplane all throughout a multi-state region.
Meredith travels around the state and into western Iowa to keep departments up to date on the latest pediatric treatments.
Just taking the great care that they already provide and giving them tips and tricks specific to children to make them more effective and more comfortable at their jobs.
Here's how the program works.
We have their dispatch center call our dispatch center, and then our transport team grabs an EMS radio and gets ready to go, and then their team either talks to us via cell phone or on an EMS radio depending which service they're on, and then the two teams communicate with each other about what they're seeing with the patient and where they're going to meet up.
What that rendezvous point is, and then most of the time they'll jump in our squad so we don't have to take the time to move the child to theirs, and then they work as a team with our paramedics and firefighters and their transport team to take care of that child.
It is difficult to judge how many lives have been saved since the program started, but it certainly has made a difference getting kids the urgent help they need.
Probably been at least, I would say, 15 to 20 times that we've called them in a real dire, urgent need with that life-threatening child that's there. And not all outcomes are obviously going to be what we want them to be, but we know we've done all we can for that child and done everything we can to support this community.
For Papillion Now, I'm Michael Severe.